So our next speaker is Katrine Callander of University of Kent, and the title will be Navigating Complexity, Autistic Women's Lived Experience of Trauma and Reclaiming Agency. And again, if anyone needs a break, please take care of yourself during our sessions, and we'll just say welcome.
Thank you very much. A lot of what I will talk about will echo what Amy has just been saying, but that's a good thing. It's a good thing that more of us are talking about these areas. It's a good thing that there's discussions about this and that we bounce off and see different perspectives. So thank you very much I'm going to bring my laptop up just so I don't have to squint at the kind of screen down there. So my name's Katrine Callander. I'm a PhD researcher down at University of Kent under Professor Chris Rogers and Dr. Damien Milton. And my talk will highlight my PhD work and build on how the relationship between trauma, marginalisation, agency, and indeed social power is deeply interwoven. Because there's a significant body of trauma research that sits within psychiatry and psychology, which is brilliant, but we also need to consider it from social policy and social justice perspectives. Just a very quick, we have received and listened to various kind of statistics over the last couple of days, but one of the ones that stood out to me a couple of years ago when I started my PhD project was that 9 out of 10 autistic women have experienced sexual assault. I'm also aware that this is not just, my work sits within women. Obviously, this is not just an issue in relation to women. Also here, kind of some statistics from UCAP 2023, amongst other studies that they carried out work which underscored the extremely high rate of various trauma experiences. My website also links to the wider report from UCAP and the ebook Stories Beyond Violence, where I contributed an autoethnographic chapter. But I wanted to understand, looking at some of these statistics, I wanted to understand not just what happens, but the developing process over time to review where we can specifically challenge some of these practices and try to break and influence those causal links. And indeed, to get to this temporal aspect, I carried out multi-stage verbal written narrative interviews with 62 participants, 126 interviews and written accounts with over 1 million words of data, which is essentially what happens when a deep, passionate hyperfocus connects with not quite feeling good enough as a diagnosed autistic person, but also I interviewed and I allowed everyone to speak who contacted me. I didn't want to be the next person who was the dismissal of because everyone who contacted me had experienced multiple times throughout their lives. Similar to Amy, had a participatory approach, community involvement, both in proposal and research questions, pilot stage, a focus group at Autistic, ongoing feedback to assess the resonance of the system. And I also write reflexively, evaluate my positionality, my bias, also as a trauma survivor and victim myself, but also in relation to trust and credibility, which became incredibly important when people shared their stories with me, and using kind of thematic analysis as well. So, kind of, I apologize for kind of this framework. Kind of maybe it's a little bit harder to see some of the text, but I love a circle. I love a kind of a smooth movement, but it's a visual representation of my 3 core themes. But it essentially shows how, number 1, the cumulative trauma, marginalisation, stigma, as the previous kind of questioners spoke about, alienation, the gendered othering, essentially leads to questioning, do I even have a right to be me? The dehumanizing, and how it connects to the increase in trauma severity, the growing misrecognition, the significant interpersonal kind of trauma across settings, kind of like sexual assault, domestic abuse, gaslighting, coercive control, and how this grows through structural relations. And finally, again echoing what Amy says, outlining how there's a need for systemic reform in relation to mental health and kind of support when autistic girls and women do seek help. Aspects such as misdiagnosis, professional dismissal, ongoing re-traumatization also always lead to significant aspects of significant mistrust. But I also want to just highlight where you see these two arrows is where I truly see scope to challenge some current practice. Because I want to challenge how the risk escalation is understood and how or if trauma is actually recognized. And I picked up in terms of the vulnerabilities, but I do actually have an aspect, because in recent trauma literature, there is actually quite a lot of times where autistic women's vulnerabilities is attributed primarily to our individual traits, rather than the systemic inequalities. Like differences in interpersonal communication can make it harder and risk so adults with ASD are characteristically socially naive, resulting in trauma risk. They're just two examples. But even within my participants and within myself, I didn't understand the empower balance. I accepted being treated badly, and these are correct. But they are not innate to our autistic traits. They are partial. They frame vulnerability as an inevitable individual consequence rather than situating it within the social, the structural and relational contexts that shape the risks to us. And we also need to interrogate how harm is recognized and acknowledged, and who exactly decides what counts. What are forms of distress? Why are ours being disregarded when we describe the attacks, the trauma we have experienced, when we reach out for help? I know here in the room it may be understood that lived experience and our form of communication matters, but in practice, across both medical, mental health, many other situations such as criminal, this is often not the case. So both of these challenges the idea of trauma inevitability. So let's keep that in mind while I'm just going to go into the themes a little bit more in detail. My first theme explores what thankfully is becoming increasingly recognized, but which needs to be understood in terms of patterns over time. That autistic women, or autistic people in general, experience marginalization through dismissal, lack of recognition and blame, and the external violation of boundaries can often lead to internal dismissal of needs and eroded self-understanding, self-worth, fragmenting our identity. And the gendered expectations and patriarchal norms compound this marginalization, and we feel pressured to conform to both neurotypical standards and gendered social roles. And as many of us know here, leading to masking, internalized blame, shame, issues in terms of embodiment, dissociation, significant mental health issues, which sets up the conditions for more severe trauma. But escalating trauma is also compounded by this interpersonal misrecognition. They often went into interpersonal relationships, maybe without any core sense of self, needs, boundaries, where thankfully slowly younger girls and women are achieving identification and diagnosis earlier. There may be scope for interventions for us to work, again, as we said, about relationship issues, and not just intimate, also in terms of peer relationships, because being taken advantage of by people across different spheres. And this is needed because there's misrecognition. This misrecognition erodes the ability to trust ourselves and others, the cycles of shame and self-doubt. And they're shaped directly by these asymmetrical power and systemic prejudice. And because our experiences constantly minimized or reframed as personal failings, participants describe themselves as trapped in cycles of unacknowledged harms, where in each instance, one bit of misrecognition compounded the next. Many also describe feeling voiceless when seeking help, dismissed, blamed, gaslit, or receiving misdiagnosis from professionals. And I also want to highlight that echoes within our experiences of ourselves. I do apologize, this is a little bit too personal, please trigger warning. Why do I tell my 13-year-old self that I didn't scream and didn't run away when I would fight tooth and nail for any other 13-year-old I would ever experience? How does that happen? How do you learn to not listen to yourself so much? So it creates the mistrust of the mental health system if these things are not recognized. So we are still silenced, denied credibility of our accounts. And that's where I think we need to challenge the ongoing systemic position that some of our patterns of distress, how we potentially reacted during trauma, how we express ourselves are not recognized. And even for those identifying in adulthood and for first time examining their past experiences, this empowerment does not necessarily lead to support. It does not necessarily lead to recognition. We would hope it will, and hopefully we're moving towards the same direction. What is supposed to be supportive actively can reinforce the trauma in terms of ongoing recognition. So I just have 2 slides of a few recommendations. Some of these are not straightforward, but they're actually kind of like together we can work towards this. Autistic women trauma is too often dismissed and reframed as personal deficit. So the policy, both policy and practice, must shift towards recognizing the trauma as relational and systemic, not solely about intrinsic vulnerability. Recognizing that vulnerability, but not as a reason. Reclaiming their agency and identity, because trauma erodes autonomy, and support should center boundary setting, unmasking, narrative reauthoring, enabling women to reconstruct coherent and empowered identities. Often kind of supported by peers, that is often where we see ourselves. And linking trauma to health outcomes, trauma-related depression, PTSD, suicidality, misdiagnosis. These are public health issues. And policies must integrate the trauma-informed I know we have many, we could talk a lot of things about the aspects about what is trauma-informed, what is neurodivergent affirming, but across health and social care systems. And finally, creating safe spaces for narrative work. We need ethical, supportive environments where memory and identity can be explored, hopefully with limited re-traumatization, and reframing harm as systemic failures rather than personal inadequacy. Autistic-led approaches, our voices, our collective memory to guide advocacy and support, and commitment to participatory methodologies. That we can be active partners in research, policy, service design, transforming recognition and accountability within systems that have historically silenced us. There's a couple of if you would like to get in touch further, I would love to hear from you. Would love to hear from you in terms of work. Thank you so much, and to everyone else who is working in this field. Thank you. Yeah.
Does anyone want to pose a quick question? You can approach the microphone. Well, do we have a question? Yeah, we do actually.
Thank you very much. An absolutely enlightening presentation. Quick question for you. I suppose we're all women, but we were once girls. Is there anywhere that we can refer people to, parents who are trying to support people in order to proactively protect and support and mind in advance so that we can prevent our young people growing and experiencing trauma like some of us would have done? Is there any programme that we can share with educators? Do you have any recommendations around anything like that?
At the moment, one of the team who just presented before me, I would really highlight some of their excellent work, which was specifically designed to be accessible and to reach younger women and girls. As the mother of a young daughter myself as well, I feel that there hasn't been sufficient material available, but that I think that is what they're trying to do. I would love to be able to work with the team as well to develop that even further.
Thank you.
Thank you so much.
There is a statistic that is mentioned by virtually every single professional to anyone who first learns about autism for the first time. It is that autism is 4 times more diagnosed in males than in females. But amazingly, the impacts of that statistic are often rarely discussed. As an autistic male in secondary school, typical males put me in danger and, just as a joke, stipulated that I commit sexual assault just to fit in with them. I refused to play along. What happened was rejection by them that the teachers refused to acknowledge and actually pushed me to hang out with those despicable people. But I learned something in that. I ended up becoming a big brother figure to many of my female peers who experienced assault. What was amazing were the systems that they worked hard to build to protect themselves, that did not follow typical protocol, and the teachers refused to listen to. We have to understand that autistic people are actively trying to help themselves in ways that typical people do not understand, and we need to work with those systems instead of try to dismantle them.
Thank you so much, and thank you for sharing your personal experience.